Everything is personal right here. Everything is personal right here.
Ladies and gentlemen, boys and girls, welcome to another episode of Everything is Personal. And today, our special guest is Dr. Jeffrey Gross. How are you?
Hey, thank you for having me, Len. It's great to be here.
Well, thank you for being on. I wanted to ask you, I was curious because I know people asked me before, people deal in pain management, spine and neck, but you're a neurological surgeon as well, correct?
Right.
What does that entail? What does that mean?
So neurosurgeon is a specific kind of crazy person that becomes a physician and decides to dedicate, after medical school, 7 more years of training. So you're about 72 years old when you start practice. And we deal with problems of the brain, the spine, the peripheral nerves, and certain pain syndromes and movement disorders, generally speaking.
Yeah, my next question was how much schooling, because so I went to physical therapy school and I never finished because I just realized I don't want to be a physical therapist. But I remember going anatomy and physiology and figuring out, all right, these are the bones, these are the muscles that are attached, these are the nerves. It was a clusterfuck. There was so much information, and now you're actually getting into the brain and brain surgery and all that. I mean, not only are you going through medical school, but you have additional training, a surgical training on that. So right. Is it really like a 15-year kind of training that you get before you can start? Is that how it works?
Yeah. College is 4 years. Medical school is 4 years. Residency training fellowship is usually 7 years. So that's 15.
Okay. Yeah. So it's right. So I want to get into all this, but I want to kind of go through your origin story a little bit. So where did you grow up?
I'm from a small town in Ohio called Lima, Western Ohio. It's closer to Indiana than it is to any other city in Ohio.
All right. And your family, did you, your parents were together? Do you have siblings?
Yeah. So it's generations of family, had a family business there. I had 2 brothers, and we escaped this town during the economic downturn of 1979, 1980. For those of you around at that time, you might recall the oil embargo. And
there's lines of cars trying to get to the gas stations, and the cars are like boats.
So it would take up 2 car lengths, and gas was close to $1 a gallon. It was crazy times, right? And we had a chance to sell the family business, and we moved. I finished high school in a suburb of Washington, D.C., where I also had family, and had some academic awakenings there. Went to some powerhouse schools, and then on to college. And I was looking at schools on the East Coast and the West Coast, and family was taking dad was taking a job on the West Coast, and I was all set to go to MIT, but I got into Berkeley, and my dad said, "Why don't you come out and check it out?" So we went out during spring break, went out to Berkeley, and on a beautiful day, and it was gorgeous campus, and all great scientific things that happened there. And I'm a science nerd, so I really knew that, but I didn't realize it was also Division I. They had all the colors and the pageantry and the football, and so I just said, "Oh, I could go here."
So the funny thing is, just and we didn't speak about this before. I was just telling you that I picked up my daughter from the airport. She goes to Berkeley, and go Bears. So last weekend was Parents' Weekend. So I was just up there, and they lost by 1 point.
I know. Don't remind me. I listened to that one. I watched
3 in a row. 3 in a row.
I know. We went to the first of those 3. It was heartbreaking.
Miami.
So,
yeah. So, but what an incredible place. I'm so grateful that my daughter gets a chance to go there.
It's diverse. There's always something to do, something to learn, and you'll learn from different peoples and different stories. It's crazy. It's a crazy place, but it's fun.
So I want to go back to your childhood because it fascinates me, first of all, to invest so much time in your studies and then provide such a incredible, first of all, being a doctor is difficult enough. Being a surgeon to me takes it one more level. Being a brain surgeon in a way, or, working with nerves and all that other stuff. I mean, it's such an intense type of practice, and it takes a special person to do that. As a kid, like, you're a kid in school, and you talked about moving and having an academic awakening, as you put it. I'm just curious, were you like into reading books? Were you into sports? Were you into science? Like, what kind of kid were you?
Yeah, I mean, I was the book reading kind, the nerd, and very into the science classes at the time, even though, there weren't science classes. You took the regular science. It wasn't special, until you get into high school and take the AP classes. So in high school, though, I know I'm kind of jumping out of childhood a little bit. I wanted so many of the AP science classes that I actually ended up taking English during the summer to make room for the AP science classes during the year. And I would take chemistry, physics, AP biology, all of it, because I just couldn't get enough of it.
But did you, and I talk about this in several shows, because I've had people on the show that were like, I picked up a guitar when I was 8 years old, and fuck, man, I knew I wanted to do this for the rest of my life. That was it. Did you have this epiphany when you were a kid? Like, I like science, but did you want to be a doctor? Did you want to be a healer?
There were little pieces. When I look back, there were pieces, there were signposts. There wasn't the aha moment necessarily. I remember being at the YMCA day camp in the summer, and a kid fell off the swing and his head was bleeding, and I was like mesmerized, like, we got to do something for this kid. He's bleeding, and of course all the other kids were like, oh, he cracked his head open. That was the phrase, but he just had a laceration. He was going to be fine. So it was like, oh my gosh, that was a serious thing. We got to help him. So I knew I wanted to, follow the path of Hippocrates at some point, and then inspired by people along the way, physicians, educators. It gets you, and I knew in high school, I was reading books on microsurgery. I knew I wanted to do something with my hands. I used to rebuild bicycles and things. So, in medical school, and we're jumping around if you'll allow, in medical school, doctors tend to self-sort into two groups, right? Those who think about things, which are generally the general medical doctors, right? Internal medical, and those who want to do something, the proceduralists, the surgeons. And I knew on day one, I already knew I was in that, give me the tools, let me fix it group.
Well, it's interesting also that you said this when the kid fell and, cracked his head and had a laceration, as you said. A lot of kids look at this, oh my God, he's bleeding, I don't want to look at the blood, or it's funny, oh, Johnny fell off the swing kind of thing. Yeah. You had a different approach to it. The blood didn't bother you, I'm assuming, and you had this internal kind of, I want to help. I want to do something about that. So yeah. Did you consciously pick up on that and said, I'm sort of different at that point?
Not then. No, this is a look back. I did not know then. I knew it. I mean, I can remember that day. I was probably 7 or 8 years old, but it was meaningful enough. Yeah.
Is there anything that happened in your life that was like a profound moment that said, okay, this is now the direction I have to go. Like, I'm being drawn to this, and now I want to, work with people's brains or pain or anything else. Was there anything like that occurred?
The brain thing, I think, happened during college. I became interested in neuroscience, and it was kind of the final frontier. We were going into the decade of the brain at that time, and I knew I was good with my hands. I wanted to be a surgeon, and brain and surgery, and that just kind of came together. I was also influenced by a mentor in college who was a neurologist. So I knew I was interested in the nervous system because there was so much we didn't understand. And, we were learning how to tap into that resource of the brain, and we only scratched the surface. So going into medical school on day one, I knew I was going to be a neurosurgeon. We filled out a little form, a little questionnaire on that day, and we filled the same form out on the last day, and it was identical. What do you want to be, a neurosurgeon? What are you going to be, a neurosurgeon? Day one and last day. So
And you don't have any trepidations with the amount of work that's ahead of you because you wanted to do this, like you really wanted to be that and do this. So the work was just like, that's what I have to do in order to do that, right?
It's true in some ways, and we neurosurgeons ask ourselves these questions. Because there's nothing unsurmountable when you're a neurosurgeon, right? You'll climb to the top of a mountain, whatever. We don't know if we were that way first, or becoming a neurosurgeon requires that of us. But medical school was a stepping stone. You have to get through it to get to brain surgeon. So it interesting. It was time. It was hard. We studied a lot, but I had to get through it. I was already on that long path. There was nothing about the duration of that path that gave me any pause at that time.
So I'm going to fast forward a little bit and I'm going to get back. I'm going to get on to your practice and what you do and everything else. But I'm curious because brain surgery, but also brain injury. I'm just curious if you've dealt with CTE cases at all. Is that something that is part of your practice?
Yeah, some. I mean, CTE wasn't even a real phrase until the NFL business, but traumatic brain injury, we still call it TBI, traumatic brain injury. I see that quite a bit. Now, I don't see as much cumulative. I usually see a single or multiple events. Only in the athletic crowd do we tend to see that, cumulative traumatic encephalopathy, CTE.
Yeah. So if somebody has a TBI, traumatic brain injury, so there was a car accident or, they fell off their bike and hit their head and weren't wearing a helmet or something of that nature, it's a one-time shot. So over time, when the brain rattles through, over athletics, as you were just mentioning, it starts to create a different condition. So there's a difference between having a traumatic brain injury or CTE, just an extension of a TBI.
CTE is repetitive. It's the effect of repetitive TBIs.
Got it.
Yeah.
So I want to go into your practice a little bit because I find it interesting about evaluating your approach to evaluating pain and the actual cause of pain. So I'm going to use me as an example. I have a couple different issues in my body that once in a while cause me pain. So I have a herniated disc and I have a torn meniscus, both sides. So if I have pain in my back, I've had this so many different times. Like, hey, well, we can shoot it up or we can do an epidural. There's things that we can do. And I'm like, does that change the disc? Like my disc is still herniated or what does it do? What is the purpose of that? Well, no, it's going to address the pain, but that is not what I'm trying to address. I'm trying to address the sense. So I'm curious about your approach to this.
Yeah, I think this is crucial, and hopefully will help a lot of people that might listen to this. And let's unwind one little piece too, because we were talking about brain injury and brain surgery and neurosurgeon, and we're talking about spine. And there was a shift in my training that pushed me into the spine that I think I'd like to just touch upon, if that's okay.
Yeah, please.
So I was 4 years into my residency, and we were doing a lot of brain surgery and very little spine surgery. And after getting to know the practice, at least through the hospital and the mentors and the professors, neurosurgery is a lot of spine surgery, and the spine is part of the nervous system. And it occurred that my particular training program was just heavy in the brain, and if I wanted to go into practice, I better learn something about the spine more than I was already learning. So I took it upon myself to find a fellowship, which is a designated year in spine, which actually turned into 2 years. I actually ended up staying at this other location and finishing my training as a chief resident to get more spine experience. And I worked with one of the greatest mentors in the world in spine surgery who instilled upon me a great love for the spine. And the spine, when you look at it, is actually way more complex than the brain. the brain's a jello mold. Let's face it. It's a soft structure. It's not precise when you cut into it. It's the outcomes are not as rewarding as one would like, even though benign tumors and certain bleeds and things we can help. A lot of people don't ever leave a hospital bed with a brain type of a bad brain injury, a bad brain tumor, a bad brain bleed or stroke of some kind. And that just lost its rewarding nature to me. But the spine, man, the Sherlock Holmes puzzle of figuring out the source of pain was the key element. And that hits upon your present question, how do we do that? And first and foremost, it's really important to not just treat everyone the same as an algorithm, but instead to identify what we call the pain generator. Because the spine could be having pain from a disc problem, 2 disc problems, could be a joint problem in the back of the spine, could be a combination, could be related to the nerve that's passing out the spine, could be related to the nerves passing down the spine, could be related to a muscular or ligamentous structure or a fracture. There are so many different things, and sometimes it's a group of them. So this is you really have to take apart the wristwatch and all the little gears and figure it out. And sometimes we use injections to do that, where we numb one spot to see if it temporarily relieves the pain. And you said, wait a minute, those shots aren't really fixing anything, and you're 100% right. So most spinal injections are designed they're done right, confirm a source of pain, and deliver direct anti-inflammatories to an area of pain whereby inflammation has a role in that pain.
Right.
And sometimes that helps treat it for a while. It doesn't fix it. We call that palliative care. And sometimes you palliate something, it feels better, and then the patient gets stronger, feels better, and they're able to overcome that acute pain cycle. But when they have repeat acute pain cycles and or chronic pain, sometimes those injections aren't enough. And that's when we have to look at something more logical, which is one of the reasons I'm into the regenerative medicine side of addressing spine and joints and other things now, because it's a new tool, a logical tool, a natural tool that we've had for many decades, especially if you're from Europe or Asia, or you're a professional athlete that left this country to go get it somewhere else and you've come back. And that's why I have this renewal of my practice to add this stem cell based approach.
It's ridiculous that we have to, and I want to dive into the legalities a little bit of stem cells. So in my knee, I got exosome injected in my knee. I'm not sure if it really worked yet. I'm not 100%. I just had one injection. It's a wait, could be a couple months until I really.
It should be.
Yeah.
So any regenerative injection, whether it be PRP, stem cells, and or stem cell derived exosomes, which are the small vesicles that are given off by cells, for them to cause a regenerative effect takes months. In the spine, it takes even longer, is my observation. However, some people feel better earlier because they have a very natural anti-inflammatory effect.
Interesting. Why do so many people, at least in the United States, I don't know about the rest of the world, suffer from back and neck pain? What do you think?
Well, lifestyle. Here you and I are sitting down, talking to each other, and I do spend a lot of my day at my desk, and we're sitting in one position. And these, sitting is the new smoking, right? It's bad for us in so many ways. We lose our core, we lose our muscular tone, we lose the bulk of our paraspinal muscles, we have atrophy, we have weakening in the neck and back. I mean, we could go on and on.
So sitting is one thing. So, those standing desks and all that stuff, you would say you recommend that. Is there anything else that people should be doing besides injuries? And I understand that, but just in general.
No, generally speaking, Americans tend to carry more weight than their European counterparts or their Asian counterparts. So the weight is stressful, at least on the low back. So I would say lifestyle factors, pro-inflammatory factors, things in our food, increase the rate of biological inflammation at the cellular level in all our body parts. And that's why sometimes you see a person who has aches and pains in the joints and they clean up their diet and they start eating an anti-inflammatory diet, or they remove maybe dairy if they have a sensitivity, and all of a sudden their joints feel better.
So inflammation, stress?
Yeah, stress, neurostress, psychological stress is inflammatory, right? You release these pro-stress hormones, increases the amount of cortisol from your adrenal glands, the stress hormone, and then you have your cells are programmed to respond to that cortisol by making more pro-inflammatory cytokines. That word, it was very popular during COVID because people who ended up in the ICU with all the inflammation in their lungs and that area had cytokine storm, basically, a severe form of inflammation.
So would you say that would be how do I say this? An overreaction by your immune system to an overreactive immune response?
Yeah, probably more glandular system, your adrenal glands, to that. But yeah, I mean, we use this word inflammation sort of generally speaking, but it really is a cellular behavior. What are your cells doing? What kind of production are those factories involved in? Are they making youthful, healthy, restorative, reparative, maintenance things, or are they busy fighting the world? And if they're busy fighting the world, that's an inflammatory cell metabolism. They make cytokines. They're not able to repair. They're more likely to produce zombie senescent cells.
Yeah.
Things like that.
Yeah. And I want to talk about like health span, longevity, and all that stuff. You brought up the senescence, it's the Sinclair's kind of whole thesis of longevity, and I definitely want to get into that. But I want to go back to what you were saying because I brought up the legalities around stem cells.
Right. Right.
So first of all, I guess we should tell people what are stem cells and then what kind of stem cells you can get and why are they even illegal in the United States or certain ones.
Right. Okay. Well, first of all, stem cells are the cells that create a fetus, the fetus that becomes a baby, the baby that grows. They help us grow and develop. And then when we're adults and we're full size, they help us maintain, repair, and heal. As we age and we are exposed to inflammation over time, some of us more than others, then our stem cell function declines. And one of the theories of aging has to do with these sort of exhaustion of the stem cell activity. So those stem cells, when you're a fetus, are omnipotent. They can make a person. They can develop as they develop into from omnipotent to not quite as powerful. They can become pluripotent, and they can make a limb. And we're going to learn from those how to regrow a finger and how to regrow an arm someday. And then once you're born, those pluripotent cells are even less powerful, but still powerful. And those are called multipotent stem cells. And those are, when we say stem cells in any type of medical use, we're talking about generally these multipotent stem cells. Now, a Nobel Prize was given to a man named Yamanaka for identifying small peptides and proteins called factors that induce a stem cell of a multipotent type backwards along their embryonic line towards a pluripotent. And those are being used for incredible research right now, but they're not generally available. So
because they're embryonic stem cells.
Correct. So you use the word illegal, and I think that's probably an imprecise term, but I certainly wouldn't offer them to anyone. I can't get them without probably finding them in some nefarious way. And so they're just not available in the US. They are now starting to become available in China. And we've all probably seen recently, and here we're recording this in October of 2024, but recently there was a report from China that they cured a case of diabetes. Well, they used induced pluripotent stem cells to do that. So regular multipotent stem cells, the typical kinds that we can extract from you or get from a donated source and use in some strategic way for health to help you with health and wellness and something. And the kinds of biologics, not just stem cells, like you said, exosomes, these things are from multipotent sources, and those are available. They are not illegal.
Mm-hmm.
And there's a great myth around that. So your question deals with legality. So let's set the standard here.
Mm-hmm.
The FDA regulates drugs, medical devices, and biologics, and these fall under biologics.
Mm-hmm.
And they have not yet given approval for marketing claims as to PRP, which is regenerative medicine, stem cells, and they usually mean any kind of stem cells.
PRP is extraction of your blood, spinning
Yep.
it in.
You take some blood, you spin it in a centrifuge, which separates out the red stuff in the plasma, and then in between is a little bit of growth factors and platelets, and you pipette those out, you add them together, and you re-inject them back in a place where you need them, like tennis elbow or something.
Right.
That's low-level regenerative medicine. There's probably growth factors, exosomes in there, maybe some cells. Stem cells will be the next one up, and the most advanced one would be the stem cell-derived exosomes, which is the stem cell business end, the signaling factors
Right.
that go from stem cells to your cells. So your cells can participate in the regeneration, the healing, the restoration.
Why are we not permitted to use embryonic stem cells in the United States?
Because we don't know how powerful they are, and we don't know what bad things they can do yet. And they are not proven. And for those of you listening at home and not looking at the video, I just did air quotes around the word proven, because the word proven is kind of misused in this country. And proven in scientific terms means there's adequate scientific publications in medical journals or scientific journals that demonstrate something. If it's reproducible and demonstrated more than once, it's even more proven. So the FDA says you cannot make a marketing claim because these things aren't proven. It's only because they haven't assigned a panel that is okay with the scientific literature out of Europe and Asia where it's proven. And I think their heart's in the right place, but there are all kinds of political and economic pressures that slow things down here, and that's one of them.
Is it more political in a way where, because it's embryonic, was that the biggest challenge to that, or is it because it never went through a full FDA 3-phase approval process?
No, Len, there are plenty of investigational new drug phase 1, phase 2, phase 3 going on. It's and maybe we'll see that, but they haven't approved marketing claims for PRP. Yet health insurers are starting to pay for it because the bean counters that are there to help the insurance company profit have decided that it is cheaper, in fact, to pay for PRP than it is to pay for a surgery or something.
I'm going to ask a question in a minimally educated way, so correct me if the question is incorrect. So we have a partnership with a company where we do genetic testing, and they specialize in NK cells, natural killer cells.
Yes.
Offshore.
Yes.
One of the things that the doctor that's creating the cells told me is, in order for a patient that has cancer or whatever they're trying to address with the NK cells, mostly it's cancer patients, you have to have you have to be in between treatments, because you have to the scaffolding has to be clean, because the stem cells can actually replicate cells in a way that may be harmful and create more harm than good. I'm trying to ask a question, so correct me if I'm asking incorrectly. Is that really the case? And how do you know if you're having treatment or something else? How do you know when you're injecting stem cells? How do you know you're not going to replicate the bad, I guess, in a way?
Right. So when you say between treatments, do you mean between like chemotherapy and radiation?
Yeah, exactly.
Right.
Exactly.
So listen, regenerative medicine, generally speaking, is having a growing role in cancer treatment. Some of these are through what are called CAR T cells, CAR-T.
Mm-hmm.
But you hit on something that's actually a project we're working on here. And I think you and I may have talked about this once, called NK cell exosomes. What's an NK cell? NK stands for natural killer. And a natural killer cell we have in our body right now. Those cells, there are very few of them. They come from the bone marrow, and they go around the body looking for mistakes and escorting them out of the building. So they attach themselves to very abnormal cells, accidental cancer cells that we make all the time, and we do. And they selectively kill them without harming our other cells. And they do that through something called an NK cell exosome. So those NK cells and their NK cell exosomes are a very hot area in oncology treatment. So there are different strategies. NK cells have to be activated. NK cell exosomes do not. So the NK cell exosomes are probably going to be the go-to. That's what we're working on. They're hard to get. They aren't created. They aren't manufactured. They are basically separated out from a group of exosomes, or they're separated out from, you separate out the NK cells, let the NK cells make the exosomes, but sometimes they have to be induced. And we're not supposed to use any manipulated tissues. We want natural, just the way it comes out of the body, right? So your question, though, is these things are only supposed to be used during a period where you're not suffering the throes of poisons from the chemotherapy and the radiation therapy, which are strategic poisons. But I would think this. If you're suffering from chemotherapy and radiation and you put in some biologically active tissue, it's also going to suffer. It's not going to have its effect. It's going to suffer the effects of the chemo that's lingering in that. So I think I would agree that I would want someone who hasn't had recent chemotherapy or radiation therapy. If we were doing a stem cell or NK cell or exosome based augmentation or approach to helping someone fight cancer.
I just don't understand why people wouldn't try it. I have a friend of mine passed away 3 weeks ago, I think now, maybe just about a month ago, glioblastoma. So a year, he was sitting at dinner, got up, passed out, had a seizure, didn't know what was going on. One got scanned, stage 4 glioblastoma. I mean, what an awful, awful disease. Otherwise healthy guy. Right away, went to traditional, I have the best doctors, Penn, this, that. They never recommended any of these things. Never. And I'm just curious, why would you not? Because, I in the business where I was working with people with cannabis, we used to get people who would come in and last resort, 6 months to live, we'll try anything. Okay, right. And we prolong life for years and years and years, not with everybody, but a lot of success on different things. But I just want to understand why, and I hate to use traditional and not traditional, but why are other surgeons, doctors, medical professionals not utilizing this because it's natural, comes from the body?
I got to tell you, this comes from when you were trained. So, and if you had asked me 7 years ago, before I sort of made the jump and added this, these cutting edge things to my practice, I might have said the same thing. Hey, those aren't ready for prime time. But if you look at the literature, what the knee work I do, the joint work I do, is based on papers that have over 15-year follow-up in France, and the cutting edge stuff in China and in Korea. We are just so far behind here. So when I was trained by my professors in the 1990s, who were trained in the 1970s, I looked back and I said, I'm not doing anything differently than they were doing in the 70s and in some cases the 1950s. Yeah, there's a new smaller incision, there's a new widget, there's a new tool. That's the same thing. We're doing the same thing, and
it's fascinating.
It struck me at some point, and that was part of the impetus for me to go back and say, what has gone on with stem cells in the last couple decades since I looked at them in college?
I mean, I understand that, and I'm just playing devil's advocate here. Yeah. Doctors have to take continual ed. So I go to the A4M conference every year, and we go. There's continuing education, and they're talking about cutting edge stuff.
Right.
So yeah, I understand you went to medical school, and the same thing with the endocannabinoid system. People, it was discovered in 1992. People went to medical school before that, no idea, and even after that too. But you have the CE, like you're having whatever the latest and greatest is.
Oh, there's continuing education is not happening. It's you get regurgitated the same old stuff. We go to these annual spine meetings and you have people wearing bow ties, patting themselves on the back for reporting the same data that was reported 40 years earlier. Mm-hmm. And I know I'm upsetting some friends there, but that's what's happening. There's very little that's pushing the envelope. I went to the North American Spine Society meeting in Los Angeles last year. Mm-hmm. Might have been the year before. I think it was my 21st or 22nd year in the organization. And I was already into regenerative medicine. And I took a video, I think it's on my Instagram, that they were like, they have, educational posters at these meetings, all the medical posters, people doing this study, that study, residents, fellows, whatever. There were like 3 little mentions of stem cells, and they weren't even really cutting edge or applicable. They have 800 things of how to put a screw and a rod in a spine.
Yeah.
Or use anti-inflammatories differently, but not, it's the same old stuff recycled in this circle, and it's not advancing. And I noticed that, and I look back and go, that's why things have been so unrewarding for a while.
Yeah, because it's stagnated. I completely agree with you. And you brought up senescence, for instance. Let me see if we can kind of bridge the gap between this longevity. So A4M, I'm going to this conference. Now it's longevity. Okay, right. Well, longevity, it's the new hot thing. But who the hell wants to live till 120 if the last 30 years are sick? So right. It's not about living long, it's about living healthy a long time. And so can you use stem cells and exosomes and these things, can you use them in a way to mitigate? So you're not addressing an issue that's happening now, but are you utilizing them to mitigate something else that may come up in the future? Is there a way to do that too?
I mean, look, anything you do that fosters longevity also probably fosters healthy longevity or health span. You hear these people, oh, it's not just longevity, it's health span.
That was me. Yeah. I just said that.
No, but it's not just you. And I didn't mean that in a derogatory way.
I'm kidding.
They really go hand in hand. Like if you fix your diet and you exercise well and you don't smoke and you don't drink and you think good thoughts and you sleep well, yeah. You're fostering longevity. You're also fostering healthy longevity. So
makes sense.
The people who have longevity, but they're in the nursing home for many, many years, are people who probably have genetic predisposition to longevity, but they don't live healthy.
Yeah, that makes sense. Yeah. They epigenetically turn on other things that are causing their diseases or something like that. Okay.
But your underlying question, can we use these regenerative medicine biologics? Yes, the answer is yes. Why? Because they help fight against the inflammatory cell behaviors. Those cell behaviors are the ones that portend towards disease development, diseases of aging, which are AKA diseases of inflammation.
Yeah.
And if you can slow that development, prevent that development, and in some cases reverse that development, then you're going to live longer and live healthier. So they are part of a strategy. By themselves, they're not the sole strategy. You got to do the work. You got to exercise. You got to eat right. You got to get your protein. You got to get your vitamin D, and we could talk supplements all day long. Hormesis, everything. You got to.
Let's talk about all that stuff because I'm curious because there's a lot of noise, right? So everybody like. Let me rewind back because I had a question for you. Do you know who Dr. John Sarno is? Does that name?
I know the name, but I don't know.
So Dr. John Sarno, years ago, I already mentioned my back, and I remember laying in bed because my back was going out. My ex-wife was trying to make an appointment for an epidural, and I'm so fearful of anything that's invasive. I always have been, even getting my blood drawn. I'm just afraid of those things. So I'm like, is there anything else and anything else? And I was listening to Howard Stern, and Howard Stern was talking to this guy, somebody, I don't remember who his celebrity was, came in, he was talking about back pain. He goes, have you ever heard of Dr. John Sarno? He's my doctor in New York. So he wrote, I think the first book he wrote was The Mind-Body Connection, and he wrote Healing Back Pain or vice versa. So I engulfed these books, and I was like, holy shit, inflammation. Well, stress and what I think, and I'm going on vacation. And now my first 2 days of vacation, I'm laid out because my back hurts. But why? It's supposed to be such a relaxing thing. No, I was stressed about going on vacation, carrying my bags, my ex-wife, the room may not be good enough. It was all this kind of thing. So I was like, well, I carry my stress here. So yes, I have a legitimate injury, but it doesn't hurt all the time. It only hurts during inflammatory response. So as you already, mentioned really well. So I wanted to see if there's a way that we can utilize some of these things, like David Sinclair, who I mentioned from Harvard. Anybody can go and look up a lot of his work, and there's a lot of different people have schools of thoughts, but they talk about senescence. They talk about, all right, after a while, your mitochondria stops working the way it does. The ATP stops producing. We have these it's zombie cells, and we can't. Now your mitochondria is wasting energy on these cells that need to be exposed of. So I was always thinking, like, what can we proactively do to mitigate some of that? So we have those energy reserves as we get older. So I was just thinking, regenerative medicine to me is also can be preventative medicine.
Yeah,
So
I totally agree.
Mm-hmm.
I totally agree. But when we have people come in and I'm interested in regenerative medicine to deal with something, anti-aging, whatever. If they're not doing the other work, it's not going to have the same effect. So we want people to do all the lifestyle epigenetic things. We go through top to bottom. We break them down. We deconstruct. We get them on track. And it could be hormone optimization. It could be sleep hygiene. It could be, hey, you can't eat after dark. A bunch of different. So we go through the whole thing.
So is there like a screening that somebody can go to? Like if I were going to your clinic, or I make a recommendation to come to you in the Vegas area, there's a DEXA scan, there's blood work. Like what would you say? I'm going to screen you for everything. What is that? And then here's a suggested protocol. Here's what you can do short term. Here's what we can do long term.
Yeah. So we don't have a cookbook, right? So in fact, I'm trying to get away from that whole, algorithmic, insurance company driven, watered down healthcare, sick care system, I should call it.
Sick care.
We like precision medicine. So we get to know each other. It's a relationship. Tell me all about you. We go down, how's your sleep? Tell me about your ritual before sleep. Tell me how you feel refreshed after. We go about your diet. Tell me what you had in the last few days. How many grams of protein do you think you get? Where do you get that protein? Like we break it down and we decide what you need to evaluate. And everyone has a different appetite. Some people just aren't going to go do all these body composition tests and stuff like that. So we customize it for the personality of that person. And then we say, hey, you may benefit from certain things here. Let's start out with some basic anti-inflammatory supplements, probiotics, vitamin D3, extra fish oil or omega-3s, magnesium at night, melatonin, not just to go to sleep, but to get more restorative sleep, because that is a peptide you need. Your cells help repair better at night. We repair in the dark. Yeah. So we should go to bed hungry. We repair better when our cells are starving. So there are a lot of little tricks and tips, and I'm trying to actually gather all that and put it in a book, which has been a long project, but we'll ship you a copy once I get it. Once I finally get it.
I want you to come back on it and talk about it, because I'm fascinated by precision health and wellness. This is sort of my mission in life, and I look at it more from, let's start with your DNA. Like, I want to understand what your own personal GPS is, so we can work with people like yourself that can know what sharp corners to avoid, so you can genetically not turn things on that you don't want to turn on. So you're not operating in the dark. It's 100%. Not covered by insurance. Like, and you said it right. We have this system that's this amazing subscription model that's the big pharma, and I have nothing against it. You mentioned hormone optimization. It has to come from pharma. I'm all for that. But when we have this cookie cutter approach, and we have insurance companies that are, as you said, bean counter said, not covered. But it's costing. There's so much cost of healthcare. If we can just prevent people from being sick, we'll, reduce the burden on the healthcare system. But I don't know if that's in the best interest of, the people who have this subscription model. So.
You're hurting. This whole regenerative medicine is going to negatively impact big pharma and big implant. Big implant would be like knee replacements and spinal hardware and things like that. Totally.
You know what I want to ask you, once again, a personal question. I know there's people listening. So I'm already in my third opinion for my knee because I just did not want to get surgery. One of my really good friends is a surgeon. He's like, oh man, it's like a hangnail. Come in, incision, come in there. He actually drew it out. I'm like, yeah, but this is inside my body, and it's a hangnail on the outside, but this is inside. What about scar tissue? What about all these other things from surgery? And he's like, it's easy peasy. But so the last third opinion I got, the doctor said to me, well, I make a small incision in your hip. I go in and I pull out your marrow. We spin it and we re-inject it back in the knee. What is that?
So you're going to hear a lot of different opinions. If you see 3 more doctors, you'll get 7 more opinions, right? Exactly. So, and that's okay. In the neurosurgery field, that's the big joke, right? You see 2 neurosurgeons, you get 14 opinions. But the what they're talking about of your hip isn't actually your hip joint. It's the back of your hip crest in your lower back off to the side, the pelvic bone, which is an easy target to draw out some bone marrow. And what's in the bone marrow is stem cells, right? Stem cells, growth factors, all that good stuff. And they put it back in your knee in different places, depending on that doctor. And there are different strategies. Many of them work. There's not one right answer. There are many right answers for you. And why, like you said earlier, why not try that before a surgery? Now, I do a lot of that, but every now and then I have a patient who's got some like little piece of meniscus flipping around in there from a tear that the stem cells aren't necessarily going to fix, and someone's got to go in there and trim that out first.
Yeah, because it's folding under, and you get this pulling
bucket handle tear, and your knee grabs and locks up.
That's what I have.
You may need a little trim there, sad to say, but you should be aware, and hopefully your surgeon would tell you that although that would help you, it does somewhat accelerate the degeneration of that knee over time.
Exactly. And I'm an active person. Yeah. I hike all the time. And that was my biggest concern. I said, logically speaking, if you're going to remove something, maybe you can replace it. And it's like, well, no, but if you make it smaller, then I'm a candidate for the degeneration, as you mentioned.
Yeah. So whether it's at the same time, which would be convenient, you can enhance your biology in that area to re-stimulate the factory that made that joint in the first place for a new factory order for some additional cartilage, collagen, proteins, those kinds of things.
So cut it out and inject stem cells back in.
It's somewhat, yes. It could be stem cells. It could be stem cell derived exosomes.
Yeah.
And there are doctors I see post on LinkedIn. They're doing PRP for the same thing. And you know what? All of these doctors are getting some results. Yeah. Now, I think exosomes are more powerful than stem cells because of how you can concentrate them. Plus, they're less than half the price while doing the same work. And stem cells are more powerful than PRP. So PRP is sort of the low grade way to do that.
Agreed. I moved on. What are your thoughts on plant medicine?
So I'm a very, very big on phytonutrients. I'm learning more about adaptogens and mushrooms. And we know that many plants, fruits and vegetables contain exosomes. Those exosomes actually interact with our cells and deliver similar primitive peptides, growth factors, and proteins. So I'm all for it.
What are some of those plants?
Well, basically, they're all the healthy fruits and vegetables you can think of. I wouldn't do poison ivy, but I mean, you can actually get in Europe exosomes derived from like grapefruit and other fruits and certain vegetables.
Amazing. Yeah, I was told to look at the color first, go with the purples first, and then the reds next, and maybe stay away from the yellows for a while.
Oh, really? Okay, because you're supposed to eat your spectrum. We're supposed to have diverse colors and biologies and different fruits and different vegetables, because usually we tend to eat a very watered down, if you're here in the US, you're eating a lot of corn and beans and things just like grown with pesticides.
Yeah.
Even the organic ones have they're only 95% organic, right? You have to know they're not perfect. And the glycophosphates we're seeing and all the other junk we're accidentally imbibing.
I love your approach, Chef, to like precision wellness and healthcare, and looking at all these different things, because that's the way that I would want my doctor to be with me. When my daughter, I remember last year when she was going to school, she needed to fill out a form that she went to the doctor before she went back to school. And it was like a 15-minute visit. And it was the same thing they did in 80, like listen to her heart, hit the mallet. I was really, man, that's not, doesn't sound like personalized medicine to me, but this is a great approach. So before I get into, I asked all my guests some music questions. Before I get there, and you already said it, but I just want to kind of tie it all back together. What would be some of the most important things that somebody can do to mitigate, that disease state that may be expressed in them? What can people do?
Yeah. So the simplest thing you can do, costs you nothing, is to do some weight bearing exercise on a very regular basis. The more intense, the better. It doesn't have to be for an hour. If you run up and down the stairs 15 times a day, you will live longer. You will have muscle mass, and you'll have bone density. You won't have osteoporosis. So muscle mass and bone density both correlate with healthy longevity. So that's an easy thing. The other thing is I wouldn't graze after dark. I would stop your calories at dinner, and you don't eat anything till the next day. And when you do start eating, breakfast should be protein. We don't need all these carbs. We don't need cereal. We don't need, muffins and donuts. Don't get me wrong. They taste great. I've had them. And I could go for one every now and then, but we should look at the Europeans. They have eggs, they have meats, they have fishes for breakfast, right? So that your furnace gets started up with protein. It stokes the fire. So you want to get the metabolism going. I would say do everything you can not to sit all day like we're doing right now. Long commutes, if you can avoid that. Get up around, move around in your office. Besides strength, flexibility is good. There are studies showing that yoga releases stem cells. Eat clean, eat healthy. You're going to release, increase the circulating population of stem cells if you eat diversely and healthy, real food. Hopefully some of our laws will change and we'll get fewer of these additives here in America. If we can catch up with the Europeans on that, we'd be better off. I would say get real sleep, deep sleep, melatonin, dark room, cold room, cold face, mouth tape, breathe through your nose, and track your health metrics. Use any device you like, an Apple Watch or an Oura Ring or something like that. Track your HRV, your heart rate variability, a very sensitive health metric. And, sleep is a big component of that. And then, think good thoughts. Try not to be stressed, meditate, listen to music, laugh, release the good neurotransmitters, make love, do it all. Peace and love.
It's my favorite one.
That'll get you started. There's more, but that'll get you started.
That's great. So I don't eat breakfast. So what do you think about this intermittent fasting?
Yeah, I don't like the phrase because we're not supposed to eat during the dark phase, so they're not really fasting. Yeah. It's time restricted feeding or intermittent feeding. But yeah, we can call it intermittent fasting because that's the popularized term. But I'm a huge fan. It's something I do personally because it's one of the easier things I can do and be disciplined about. I'm just not a hungry guy in the morning anyway, so it's easy. I can have like a black cup of coffee or some water or something without calories, and I can make it easily until lunchtime, at which time I break my fast with lunch. So my lunch is breakfast, or my breakfast is lunch.
Yeah, exactly. Same. All right. So now I have a few music related questions. Uh, do you remember, and if so, what was the very first concert that you attended?
So, I grew up in this small town in Ohio. We did not have concerts except the local symphony, which was, a group of ragtag, music teachers who got together. And then when I went to high school, the Rolling Stones came around in their farewell tour in the 80s.
Yeah,
And I
exactly.
think they've toured ever since then.
I just saw them a couple months ago.
That
Farewell.
was their farewell tour. I did not see them because the tickets were so expensive at that time, and I was just a starving high school student saving money for college. So I think in college, towards the end of college, at the Greek Theater in Berkeley, I saw Spyro Gyra,
Okay.
and I know I spent one summer in Los Angeles working at Cedars-Sinai Hospital, and I saw Oingo Boingo. I know if you put all those names together, it's like Spyro Oingo Gyro Boingo or something. But and both were fantastic. I saw Oingo Boingo at the Greek in Los Angeles, and I saw Spyro Gyra at the Greek in Berkeley. So I apparently only like Greek music.
That's right. What was the last concert you attended?
Oh, I just saw Maroon 5 a few months ago. My wife took me to Maroon 5 as a
They're
treat.
doing a residency, right? In Vegas, was it?
It might be a touch and go residency. They come and go.
Okay.
So, but
Got
they
it.
were fantastic. It was they put on a great show.
All right. So another music question. For the next year, you could only listen to 5 albums. You don't have to remember the name of the album. It can be like Maroon 5 or whatever it is.
Okay.
What would be
Uh,
those 5 albums?
it would be Dizzy Gillespie, and I can't think of the album, but it's the one with "Someday Your Prince Will Come," the Disney song. So it would probably be that one. I would listen to The Police. I'm a big fan of their style, especially the earlier stuff. Message in a Bottle and all that. I would probably listen to, gosh, maybe some Smiths. You're really making me sound eclectic here. Some good old-fashioned Smiths. Um, we probably need something peppier in the mix in case I need it. So, um, gosh, I wish I had prepared for this one. I would listen to some old big band stuff. I think that would, who I really like? I like old, like Stan Kenton, and maybe even like some Tito Puente, maybe some Latin music.
Yeah.
So I think I would pick that. Those are probably things I go to. A little bit of this, a little bit of that. Unless I needed to really relax, I'd pull out some classical, maybe some Beethoven or some something like that.
Got it. All right. So final question. Please describe what your room looked like growing up.
So I had blue carpet, red bedspreads, and white walls. I was a very patriotic kid, hand to the heart, a kid. I had that. I had posters on my wall when I was in my teens. I'd go to the record store. Remember the record store?
I
You
used
go
to
to
work at Tower Records, by the way. I used to be a music buyer at Tower Records. So yeah, I
Okay.
definitely remember records.
So, they all the promotional posters, after they took them down, they'd have them in the back, and you can go ask, "Hey, you got any?" And I had like all kinds of music groups I didn't even listen to on my
do,
on my
do you
walls.
remember? Do you remember some some of the posters?
I had a poster of Cher. I got out of Dynamite magazine, if you remember that.
Yeah.
And I had a poster on my wall from Spencer's Gifts. It had black velvet and cool colors, and you're supposed to shine a black light on it, but I never got a black light. Stuff like that. This is very 70s. But Farrah Fawcett, of course, we all had the Farrah Fawcett poster, the classic one, and stuff like that.
Cool. Where can people contact you? Where can people find out more information? Where can they engage with your content?
So the practice name now is called Recelebrate, because you're celebrating the renewal of your cells. So that's, if you look that up, it's RECELLEBRATE. And that's our website, recelebrate.com. It's our Instagram, it's our LinkedIn, it's our YouTube. It's just that word. As far as I know, we're the only one using that word, that spelling.
Yeah, great. And for my audience, thank you so much for staying with us. I hope that you've listened to the whole, you listened to the whole thing. So you're here and you found it interesting. And I got to say, I really appreciate the reviews. Got a lot of 5-star reviews, and some 4-star, which great. Just give me some input. I'll get better. And thank you for, buying the book, Making Cannabis Personal as well. And, I appreciate everything. And John, I really appreciate it. It's fascinating. And I think, I really want not only just my audience to listen, but other healthcare professionals, because I want them to be inspired by precision health and wellness. The healthcare needs to be personalized. And the more we get away from this, this model of sick care, as you said, we can really help a lot more people. So I appreciate what you're doing.
Thank you. Yeah, doctors out there, don't be afraid to do the right thing, even if an insurance company or the government tells you that's not the right thing. Your Hippocratic oath comes first, like mine does.
Awesome. Thanks so much. Appreciate it.
Thank you.
Hey everyone, thank you for watching and listening. And don't forget to hit the subscribe button, share this episode, and hit that bell. Like, comment. I so appreciate that. And check me out on social under Len May or Len May DNA. Find out more on LinkedIn or lenmaycoaching.com. And remember, everything is personal.